I want you to close your eyes for a moment and imagine Mrs. Gable. She was 74 years old, living in a quiet suburb of Cincinnati. When she first came into my office, she wasn't walking. She was being pushed in a wheelchair by her son. Her face was etched with the kind of weariness that only comes from years of chronic, grinding pain. She told me, through tears, that her local clinic had already filled out the paperwork for her to move into an assisted living facility. Her knees were bone on bone, they said. She could no longer stand long enough to cook a meal, let alone walk to her mailbox. She felt like a burden. She felt like her life, as an independent woman, was over. But today, Mrs. Gable is 78. She just sent me a postcard from a walking tour in the Blue Ridge Mountains. She lives alone, climbs the stairs to her bedroom every night, and hasn't touched a walker in 3 years. How did she do it? Most people think the answer is a $50,000 knee replacement or a lifetime of heavy-duty painkillers that tear up your stomach lining. But the truth is far simpler and far more natural. We used a method that 97% of doctors usually overlook because it can't be patented and sold by a pharmaceutical company. We focused on the biological machinery of her cartilage using 2 specific, everyday foods. In the next few minutes, I'm going to guide you through the exact science and the detailed implementation of this method. If you've been told there's nothing left to do but wait for surgery, I'm here to tell you that there is hope, and it's sitting in your grocery store. Before we go any further, I need to know who I'm speaking with. This isn't just a lecture, it's a community. Down in the comments right now, I want you to type 3 things: your age, your primary symptom, like stiffness or grinding, and 1 activity you've stopped doing because of your knees. Are you an office worker whose knees ache after sitting for 8 hours? Are you a mother who noticed joint pain after your last pregnancy? Or are you over 50 and feeling like your warranty has expired? Type it below. I read these comments because they help me tailor this science to you. And let me tell you something your doctor might not have mentioned. This pain is likely not just bad genetics or old age. In my 30 years of practice, I found that knee degradation is often caused by a deficiency in 3 specific nutrients that the modern diet has completely stripped away. Today, we put them back. For those who don't know me, I am Dr. David Thompson. I've spent over 3 decades in the trenches of clinical medicine. I've treated thousands of patients, from professional athletes to grandmothers, and I've seen the healthcare system become increasingly focused on management rather than repair. My mission with this channel is simple: to help you live a healthy, independent life through scientific nutrition. I believe that a well-informed patient is a physician's best partner. I'm not here to sell you a magic pill. I'm here to give you the biological blueprints to rebuild your body from the inside out. Now, let's see how much work your cartilage needs. I want you to count how many of these 5 symptoms you've experienced in the last 30 days. 1. The morning rust. Do you wake up and find your knees feel locked or stiff for the first 15 to 30 minutes of the day? 2. The stairway grumble. Do you hear a clicking, popping, or crunching sound, we call this crepitus, when you go up or down stairs? 3. The weather report. Do your knees ache more when a storm is coming or when the temperature drops? 4. The giving out. Do you ever feel like your knee might buckle or give way if you step the wrong way? 5. Post-inactivity aches. If you sit in a movie theater or at a desk for 2 hours, is that first step incredibly painful? Comment the number below, 1 through 5. If you have even 2 of these, you are likely suffering from what I call the joint death triangle. This consists of ischemia, poor blood flow to the joint; oxidative stress. Think of this as biological rust eating away at your cells; chronic inflammation, a silent fire that melts your cartilage like a candle. The foods we are about to discuss are the fire extinguishers and rust removers for your knees. The first food is often controversial because for years, low-fat gurus told us to avoid it. I'm talking about extra virgin olive oil, EVOO, but specifically high polyphenol, peppery olive oil. Take Robert, a 55-year-old software engineer. He was a classic office worker. Years of sitting had caused his knees to feel like they were filled with sand. He couldn't even walk his dog around the block without taking 800 milligrams of ibuprofen. We started him on a high EVOO protocol, 3 tablespoons a day of a specific type. Within 3 weeks, Robert told me the grinding sensation had diminished by 50%. After 2 months, he was off the ibuprofen entirely. He could drive his car and walk his dog for 2 miles, pain-free. Why does this work? EVOO contains a miracle compound called oleocanthal. When you swallow a high-quality olive oil and you feel that sting or pep in the back of your throat, that is the oleocanthal. At a molecular level, oleocanthal acts exactly like a natural, nonsteroidal anti-inflammatory drug, NSAID. It inhibits the COX-1 and COX-2 enzymes, the same ones targeted by ibuprofen. But it goes deeper. Think of your knee joint as a rusty hinge. Your cartilage needs synovial fluid to stay slippery. High polyphenol olive oil helps regulate the inflammatory cytokines, the bad messengers, that normally break down this fluid. It's like pouring fresh high-grade oil into a car engine that's been running bone dry. A landmark study published in the journal Nature in 2005 titled Phytochemistry, Ibuprofen-like activity in extra virgin olive oil shocked the medical world. Researchers found that a daily dose of EVOO provided a consistent, low-level anti-inflammatory effect that prevented the pro-inflammatory fire from melting away cartilage cells, chondrocyte. Practical guide. The dosage, 2 to 3 tablespoons per day. The selection. It must be extra virgin and ideally stored in a dark glass bottle. Look for a harvest date on the back. If it doesn't sting the back of your throat, it lacks the oleocanthal you need. Golden time. I recommend taking 1 tablespoon in the morning on an empty stomach and using the rest over your lunch or dinner. Note on heat. Never cook this oil on high heat. Heat destroys the oleocanthal. Use it as a finishing oil. Pour it over your vegetables or soup after they are off the stove. Have you ever noticed that peppery sting in high-quality olive oil? Did you know that was actually a sign of medicine? Let me know in the comments if you've ever tried the tablespoon-a-day method. The second food is something most people treat as a side dish or a pizza topping, but it actually contains more joint-repairing vitamin C than an orange. I'm talking about the red bell pepper. Elena was a postpartum mom. After her second child, the relaxin hormone, which loosens joints for birth, hadn't fully dialed back. Her knees felt loose and unstable. She was terrified she'd never be able to run again. We put Elena on a red pepper protocol. Because she needed to rebuild the velcro that holds cartilage together, we focused on this high-C, high-bioflavonoid food. In 6 weeks, she felt a tightening and stability in her knees she hadn't felt in years. She's now back to 5K runs. Your cartilage is mostly made of collagen. But collagen isn't just a pile of protein. It's a complex structure of fibers that must be cross-linked to stay strong. Think of vitamin C as the biological glue or the architect that assembles the collagen bricks. Without it, your body produces weak collagen that wears out easily. Red bell peppers are also packed with beta-cryptoxanthin. Beta-cryptoxanthin acts like internal sunglasses for your joints. It filters out the oxidative stress, the sunlight, that causes cartilage to become brittle and yellow. By eating red peppers, you are providing the raw materials to synthesize new cartilage while protecting the old cartilage from rusting away. The Annals of the Rheumatic Diseases published a study showing that individuals with the highest intake of vitamin C and beta-cryptoxanthin had a threefold lower risk of developing inflammatory joint issues. Another study in Free Radical Biology and Medicine, 2012, confirmed that these specific carotenoids directly protect the chondrocyte, cartilage cells, from dying off due to oxidative stress. Practical Guide. The recipe: Dr. Thompson's Cartilage Crunch. Slice one whole red bell pepper. Pair it with a fat source, like hummus or even a drizzle of that olive oil we talked about. Why fat? The beta-cryptoxanthin is fat-soluble. If you eat the pepper alone, you only absorb about 10% of the medicine. Pair it with a fat, and you absorb 80%. Golden time, lunchtime. This provides the vitamin C surge during the middle of the day when your joints are under the most mechanical stress. Note on color: it must be red. Green peppers are just unripe red ones. They have significantly lower levels of these specific repair compounds. Which do you prefer, raw peppers with a dip or lightly sautéed? Remember, keep them crunchy to save the vitamin C. Tell me your favorite way to eat them below. Let's summarize. To fix your knees, we need to stop the fire and provide the bricks. 1. Stop the fire with 3 tablespoons of high-quality, peppery extra virgin olive oil daily. 2. Build the bricks with 1 red bell pepper daily, always paired with a healthy fat. My final advice is this: your body is a self-repairing machine, but it cannot work without the right fuel. If you rely only on pills, you are just turning off the check engine light while the engine is still smoking. By using these foods, you are actually fixing the engine. A gentle warning: if you have a severe, acute injury, please see a specialist. But for the 90% of you dealing with wear and tear, these foods are your best friends. If you found this helpful, please subscribe to this channel. My next video is going to be about the one drink you should avoid after 5 p.m. if you want to stop joint swelling. You won't want to miss it. Mrs. Gable didn't give up, and neither should you. I'll see you in the next video. I'm Dr. David Thompson. Stay independent. Stay healthy.